don't know how to get the.
All right.
I don't know how to get the hand down.
Midbrain is the middle of the brain. That's what it means. So if you look at this picture over here, all this is the cerebrum. We know that this is the thalamus. This area here is the hypothalamus. And this right here is the midbrain. Okay, so it's kind of like the middle of the brain. Right here on the right is the cerebellum. So if you're doing dissection and you kind of like move the cerebellum down or away, you can totally look into the midbrain right here. Now the corpora quadrigemina in this picture are these two little raised areas, but we're looking at it from the side. So you really have to know that when you look at it from the back of the brain, there's really 4 areas. And that's why it's called corpora quadri. Quadri means 4. So there's 2 raised areas on top, 2 at the bottom. So the superior, the one that I call the little butt, is related to visual reflexes. What it means is that if we are detecting something with our eyes, before it gets to the vision center in the occipital lobe, it's going to make a synapse in the superior colliculi of that corpora quadrigemina. The inferior, at the bottom of that region, is for auditory reflexes. So again, when we're hearing something, there's going to be a synapse in that region of the corpora quadrigemina before going to the auditory center in the temporal lobe. The other region that you have there is the red nucleus. So if you look at this picture again, let's see if we have the red nucleus here. It's this little region here. So the red nucleus is related, and the substantia nigra, that we have, right? Substantia nigra. Nigra means black, so it means that there's a bunch of gray matter in that region, right? And then the red nucleus is that little red region over there. So those two are related with the areas of addiction or dopaminergic neurons. It means that anytime that you have something that gives you pleasure and it makes you feel good, is because you're activating those neurons in that region, in that substantia nigra and the red nucleus. So they believe that individuals that or they have a addictive personality or they have addictions means that there's some damage or something is not working right on that region. And that's the reason why they are having an addiction, because that gives them that sensation of the dopamine secretion, which makes you feel good, makes you feel satiated in a way. Now the pons, we're going to go back and refer to the pons. Remember, the pons is the next part over, right? This little enlargement here connected to the midbrain over here. So the pons is going to come back to us when we do respiratory centers, because of when we do respiratory system. In the pons, we have the respiratory control centers, and there's 2 groups of neurons. One is called the apneustic, and the other is called the pneumotaxic. One controls the inhalation and exhalation, and the other controls the frequency of the respiratory system. So remember the pons and respiratory centers. That's the most important part of this one. The cerebellum, and again, the cerebellum is kind of like separate from the brain. Is this little structure over here at the base of the cerebrum under the occipital lobe. The cerebellum is related to movement coordination. So it has to do with equilibrium and movement coordination. So it is related to the auditory center. It has to do with our inner ear, because in the inner ear, when we get to chapter 10, we're going to study that the inner ear not only has receptors for hearing, but it also has receptors for equilibrium. So those receptors are sending information to the cerebellum, and that has to do with our equilibrium. So when we have issues with our inner ear, our equilibrium will be affected. And the other role that the cerebellum has also with emotion and memory as well. But most importantly, equilibrium and coordination of motor movement. The next very important part is the medulla oblongata. And remember, there was a movie with Adam Sandler where he was the water boy, I think. Remember that one? And he said he has the medulla oblongata was affected or something. If you haven't seen it, just try to watch it. It's very funny. We call it the medulla, and we don't say both names, but the medulla is important because it has a lot of cranial nerves that are going to be related or involved in regulation of breathing and cardiovascular system. So remember, the pons has respiratory centers, but the medulla also have neurons that regulate the breathing. And most importantly, it has the cardiovascular centers. So when we do chapter 14, we're going to talk about the medulla again, and the centers. Cardiovascular center has vasomotor and cardiac control. So vasomotor means the smooth muscle to control the dilation or constriction of blood vessels. All of our blood vessels have smooth muscle in them. So they're very important in regulating that dilation or constriction. And cardiac center has to do with heart rate, either increase the heart rate, for example, if we are exercising, or decrease the heart rate when you stop exercising and you're doing the cool down. So here are the two respiratory controls that we mentioned in the pons, the pneumotaxic and the apneustic one. And then the rhythmicity one for respiration is in the medulla. But these all three are centers that we're going to go back to when we study respiratory system. So remember the actor Christopher Reeves, when he used to do Superman. Maybe some of you are too young to remember, but he was horseback riding and he fell from the horse, and he fell on his head. So imagine how high these centers are, right? This goes into your cervical region of the neck, right? So the base of the skull will be around here, and then immediately starts your cervical one. So when he fell, he broke his C1, C2, so it affected the respiratory centers in this region. So he couldn't breathe on his own anymore. So for many, many years, he was on a respirator. And toward the end of his life, and of course, he was paralyzed, right? Because if you damage your spinal cord at the C1 level, anything below that is affected. So there's no skeletal muscle control from that region of the C1, C2 all the way down. So he was a quadriplegic. He was paralyzed from the neck down. And on top of that, also had affected the respiratory centers. So he had to be on a ventilator for the longest time. And toward the end of his life, they put on an electrical stimulator in his diaphragm. The diaphragm is the muscle that separates the thoracic cage from the abdominal region. So we have it at the base of our ribs. So it is involved, especially in triggering inhalation, right? So what they did in trying to get him off the ventilator certain time or hours during the day is that they inserted an electrical stimulator that every so often it would send an electrical stimulus to the diaphragm. The diaphragm would contract and that would force him to take a breath in. Exhalation is more passive, so all he needed was that little stimulation of the diaphragm so that he could take a breath in, and then he will exhale on his own. They did this for a few hours so he could kind of like go around and be on a, at least outside on a wheelchair, but it was very dramatic and he ended up dying. I don't know if you remember about him. And then the other important part that we have in the medulla is the reticular activating system, or it's also called RAS. So you have it right here, RAS, R-A-S. And this includes where people are awake, or when you're asleep and then you are able to be awake. The RAS system is affected in patients that are in a coma. So for whatever reason a patient is in a coma, most likely is because there's a damage on this reticular activating system and they're not able to awake. They're not able to wake up and they are in that profound situation of sleep, right? So that's serious. And depending on the level of the coma, there's 4 levels, right? 1, 2, 3, and 4. And of course, if it's coma 4, very hard for a patient to recover from that. But there also, I don't know if you heard, but now with this COVID situation, a lot of individuals that need to be on a ventilator, they need to be induced into a coma because it's very hard for a patient to be awake and be able to sustain having that intubation. So in those cases, it's a pharmaceutical coma or an induced coma where the patient is asleep because of medication and not because of damaging this region. So the last portion of the central nervous system, of course, is your spinal cord. So the spinal cord is right a continuation from the pons, and it goes all the way through the vertebral canal, which is formed by the vertebrae, right, that form our vertebral column. And there's a central canal there where we have our spinal cord. The arrangement of, and you can hear my dog barking. The arrangement of the spinal cord is a little different in ways of white matter and gray matter than the brain. The actual cerebrum has gray matter on the outside, or more external, and more white matter on the inside. Remember that white matter was anything that has myelination, right? So that's why it's white, because it's adipose tissue. Gray matter is unmyelinated fibers and body of neurons, okay? So in the cerebrum, we have gray matter on the external and white matter on the inside, with certain little areas of gray matter embedded in it. But the spinal cord is the opposite. The spinal cord has gray matter on the inside, and then it's surrounded by white matter. So this is because the white matter is making up the spinal nerves. So the nerves that come out or in of the spinal cord are myelinated. And also because we have what they're called tracts. So tracts are the same as nerves, but they're called tracts because they're going up or down. Okay, so we have nerves that are coming out of the spinal cord or in, but we also have tracts, and these are fibers, just like nerves, myelinated fibers, that go up or down. So that's why we call them ascending tracts, going up the brain, or descending tracts that they come out of the brain and down. So the name of these tracts is depending on where they originate And I don't care if you remember all of this, but if you think about just one of them, for example, one of the tracks that we have, and these are ascending, so it means that they go from the bottom up to the brain. So look at the name, anterior spinal thalamic. So without even looking at anything of the description, anterior means that it's toward the front of the body, starts in the spinal cord, that's spinal, and it's going to end in the thalamus. Yeah. So the next one here is lateral spinal thalamic. So by the name, you know that it's coming from the side of the spinal cord going up to the thalamus. If you look at these ones over here, this is how the tracks work. If you notice, the tracks don't go, the tracks can go on the same side, right? Spinal cord, brain on the same side, or they can cross and go to the opposite side. So these are just like nerves, but they're called tracks because they just go up and down between the brain and the spinal cord. And they're all myelinated. And we have ascending, so we also have descending tracks. So these ones are originating in the brain and they're gonna come down the spinal cord. And if you look at those names here, also tells you a little bit of where they're originating and where are they going. So corticospinal means that they start in the cerebral cortex and they're gonna end up in the spinal cord. Again, you don't need to know all of these names. Just know what ascending and descending tracks are, going up and down the brain and the spinal cord. They're just like nerves, but they're just white fibers going up and down. And then the last portion of this chapter is your spinal nerves. So from the brain, we have cranial nerves, right? And they are coming out of the brain. Those cranial nerves are 12 and they're on each side, and they're mostly innervating the face. They're innervating the throat, which are involved in swallowing, like the glossopharyngeal, for example. There's one cranial nerve that you have to remember for later on, which is cranial nerve number 10, and it's called the vagus. And this one you have to remember because the vagus is the only cranial nerve that it comes out of the brain and it goes inside all the way to your abdominal region, and it's going to be involved in digestion. So remember that one. Now, when you come to the spinal nerves, are the same thing, a bundle of axons that are coming out of the spinal cord. So these nerves are obviously myelinated. And when you look at this picture, they are bundled in what is called plexuses. A plexus is a branch or branching, okay? So you can see here how you have the cervical plexus, so that means the branching or the cervical region. You also have the brachial plexus, so that means the branching of the brachial region, which brachial means arm. Then you have the lumbar plexus, which is on the lower back. You see branching over here. And you also have the sacral plexus, what is branching from the sacrum. Okay, so on the right side, you can see the 12 pairs of cranial nerves. That means that they're coming out of the brain. That's why they're called cranial. So you have one on each side. That's why you have 12 pairs, right? 12 on each side. And remember, they control the head, like all our facial expressions, our hearing, our vision, all those special senses that we have in the face, swallowing. But there's only one because they're called, they have names, but they also are labeled with Roman numerals. Cranial nerve number 1 to cranial nerve number 12. So cranial nerve number 10 is called the vagus, and that's the only one that is going to come out and it's going to go all the way to the digestive organ. So remember that one, right? The vagus. It actually comes down the carotid artery, the common carotid in the neck. You learn that too. And when you get to the spinal nerves, you have 8 pairs, one on each side, right? So 8 on each side from the cervical region. You have 12 from the thoracic region, which means this region of the spinal cord. You have 5 on the lumbar region and 5 on the sacral, and 1 only from the coccygeal region, which is the coccyx, right? The end of your vertebral column has 1 little nerve that comes out there. Now, from these major branches here, we have the sciatic nerve that comes down. This is a very important nerve in our body. And then some other nerves that are going to be innervating the legs, but they're all coming out of the spinal cord. And like I mentioned, in this chapter is when you have the reflex arch, and they put it at the end of the chapter, but I started chapter 7 with the reflex arch because it's better to understand how we can receive information and how we can send information out to respond to stimulus. In this example that you see here, you have, this is not a monosynaptic reflex because you have here an additional neuron. I think that's how it should be. You have here this little yellow neuron that is called the association neuron, also can be called integration neuron. So in this case, this is not a monosynaptic reflex because you have a sensory neuron, you have an interneuron or association neuron, and the motor neuron coming out. So different reflexes get different kinds of synapses. In this case, we have an upper motor neuron that is associated with it, and you can see how it's sending that information. So this one is a little more complex than a typical monosynaptic reflex. And I don't know what that is, but I'll stop share here. Must be an animation. Is there any question for this chapter? So what I've been going through, that's what you need to know. There's a lot of detail that I'm not going to be asking for the exam. Yes, Julie.
Okay, I heard you say that the difference between tracts and nerves are tracts that go up and down and nerves go in and out. Would it also be accurate to say that the tracts are involved with the central nervous system and the nerves are involved with the peripheral?
Yes.
Okay.
Yes, perfect. Good observation.